Coronary heart disease is a disease of the blood vessels that supply the heart. It can lead to a sudden heart attack and instant death. It kills almost 500,000 Americans a year. It also claims lives in developing countries. Cardiologist Peter Libby explains why it is so frightening.
This disease can strike out of the blue. In about half of men and almost 2/3 of women, a sudden heart attack or mini heart attack can be the first sign that they have any trouble at all with their heart.
Doctors estimate that about half of those who have a heart attack did not know they were at risk. That's because the heart does not feel pain. The pain people feel during a heart attack occurs when the nerves in the heart cross other nerves, those from the arm, chest, or spinal column. Doctors can give stress tests and CT scans. They can even thread tiny cameras through blood vessels to look for arteries narrowed by plaque or deposits of cholesterol. Dr. Daniel Rader specializes in preventing cardiovascular disease.
We have tests that are pretty good at picking up the slow, chronic buildup of plaque within the blood vessels of the heart. But that's not the way that most heart attacks occur.
Instead, the way they usually occur is when a tiny piece of plaque in an artery ruptures.
Think of a popcorn kernel and what happens when you put it in the microwave. It all of a sudden bursts open. The plaque is like that popcorn kernel.
When it bursts, it can cause a clot and block the flow of blood to the heart within seconds. The result is sudden death. That's why prevention is critical. The American Heart Association advises some simple steps. If you smoke, quit. Eat a healthy diet and keep your weight and cholesterol under control. And get at least 30 minutes of physical activity 5 or more days of the week, even if you have to do it in 10-minute intervals.
Regular exercise helps to grow new blood vessels in the heart and strengthens the heart, such that if you do have a heart attack, you're more likely to survive it.
Many Americans have followed these guidelines. In the past 20 years, the death rate from heart disease in the U.S. has been cut by 25%. Carol Pearson, VOA News.